The U.S. spends more on healthcare than any other country. It's nearly 18% of our GDP, according to the Organization for Economic Cooperation and Development. That's at least 3 times as much as other developed countries. But we're still not getting a real bang for our buck.
The whole structure of the system remains totally broken, and we're not making any progress in really trying to fix that.
Americans like to claim we have the best healthcare in the world, but that's not necessarily true. Life expectancy here is 3 years lower than the OECD average, and so-called avoidable deaths are far higher. More troubling, so is infant mortality. The Affordable Care Act, also known as Obamacare, has provided coverage for 40 million Americans who are enrolled through the Marketplace or Medicaid expansion. Even so, 26 million citizens remain uninsured. That's a record low number, but still nearly 8% of the population. Most of the uninsured are low income. And even though Obamacare has made insurance more affordable, many of these folks cite cost as the reason they lack coverage. So what can be done to help? 41 states and the District of Columbia have adopted Medicaid expansion. Coverage rates in states with Medicaid expansion have increased by 15.3% among parents and 10.5% among non-parents. Medicaid expansion also seems to have improved the financial situation of hospitals by reducing uncompensated care. Still, many are concerned politicians could do something to kill that coverage. In 2017, a GOP Congress tried and failed to repeal Obamacare, but late Arizona Senator John McCain gave a thumbs down to the party's skinny repeal.
Mr. Peters.
McCain saved the Affordable Care Act even though he was no fan of the legislation. To date, Republican presidential candidate Nikki Haley has been a vocal critic of Obamacare, and she's said she's against government-run exchanges. She's also said on the campaign trail that she wants to reform Medicare and hopes to raise the retirement age to reflect life expectancy.
We go to people like my kids in their 20s when they're coming into the system and we say the rules have changed. We change retirement age to reflect life expectancy. Instead of cost of living increases, we do it based on inflation. We limit the benefits on the wealthy, and we expand Medicare Advantage plans.
What's the right age there then, Ambassador?
Well, I think we have to do the numbers. We've got to figure out what it is. But what we do know is 65 is way too low, and we need to increase that. We need to do it according to life expectancy.
But that assumes people in the U.S. are living longer. Life expectancy has actually dropped the last few years, with men at 73.2 years and women at 79.1. Raising the retirement age would cut average lifetime benefits for new retirees by 20%. Republican frontrunner Donald Trump recently posted on social media that Obamacare sucks and reiterated his intent to replace it. During Trump's presidency, he declared the Republicans would become the party of healthcare, but he failed to deliver on that promise. The main idea behind previous GOP proposals involved giving block grants to the states. States would then be free to use that money to provide subsidies or set up high-risk pools to cover expenses from high-cost patients. But the proposed legislation would have killed money for expanding Medicaid. The latest GOP healthcare proposal could come from the Choices for All project at Stanford's Hoover Institution. Choices for All includes a modified healthcare savings account with expanded tax deductibility for out-of-pocket costs. Expect to hear more about the plan ahead of the 2024 election. So, what's the alternative? Biden has continued to push the Medicaid expansion provision of Obamacare.
Look, close the Medicaid coverage gap that locks nearly 4 million Americans out of coverage just because their states refuse to expand Medicaid. Lower prescription drug costs, which was mentioned already, by allowing Medicare to negotiate prices for drugs that are on the market. We can do this. We should do this. We have to do this.
But many Democrats say that's not enough. To that end, they proposed adding a public option. The plan would be available to everyone at the Obamacare marketplace and would be tax or individually funded and administered by the Centers for Medicare and Medicaid Service. It would not involve private insurance. Democrats say a public option would provide competition for private insurers. That, in turn, would keep a lid on prices. The public option was originally included in Obamacare. It was cut when independent Connecticut Senator Joe Lieberman said he'd filibuster. Connecticut has the highest concentration of insurance jobs in the country. Republicans say the public option would lead to hospital closures in rural areas and would add to the deficit. Meanwhile, some Democrats, including Bernie Sanders, have pushed Medicare for all. In May of last year, he and U.S. Representatives Pramila Jayapal and Debbie Dingell introduced the Medicare for All Act of 2023.
Of people, including a growing number of doctors and nurses. We had a wonderful meeting last night, hundreds of doctors and nurses. And what they are saying is, you know what? We want to practice healthcare that prevents illness, that treats our patients. We don't want to work with the insurance companies and the drug companies. And more doctors and nurses are coming on board the Medicare for All movement.
Proponents say patients would get the same health care but at a lower cost. The benefits are comparable to the public option, but there would be no competing health plans available. Health insurance companies see it as an industry killer, while Republicans say it would throw people off their private health plans and give no choices, no options, and no alternatives.
Competing private insurance policies like the ones that 180 million Americans currently use would be banned outright, gone. And for the privilege of having their existing Medicare or their existing employer-provided plans ripped away from them.
In 2019, Mitch McConnell said such a plan would cost $32 trillion over 10 years, and that, he said, would lead to tax hikes. McConnell also said it would reduce payments to hospitals, making their financial challenges even worse. Where do we go from here? Most experts will tell you our system is broken and needs a complete overhaul, but there's very little political will in Washington to do that. It would take the American public saying enough is enough and require both houses of Congress to work together. In the interim, one thing is certain. America needs an affordable healthcare system that covers everyone. Ideally, one that allows people to stick with their doctor and is somehow more efficient than our current system. A public option added to Obamacare could be the first step. Nearly 66% of Americans support it. Hospitals, doctors, nurses, and patient organizations could work together to fine-tune the plan, and every member of Congress should be required to use it. It's one way to ensure decent coverage for all.